What's going on, YouTube? Sorry this is a few days late, but as promised, I'm taking you guys' questions and I'm going to start making this video series or whatever I'm doing on here about you guys and your questions about ulnar nerve surgery, cubital tunnel, limits to what you can do exercise-wise or whatever. So, first question I want to talk about today was a couple people have asked me, they'll describe their symptoms and they'll say, when should I get surgery? Should I get surgery? Um, my feeling is surgery should always be the last resort. You should try to treat it conservatively first. First, taking a step back, you want to find a hand surgeon that's good that can help you accurately identify what's going on. You might think you have one thing, but you might find that it's something completely different. So you really have to pinpoint and figure out what exactly is it that's going on with you. Most of the time you can do that yourself by reading online, and you obviously feel what's going on in your body. So a lot of times I would say most people can self-diagnose their things when it comes to this kind of stuff, because you pretty much kind of have an idea. So this one particular person was saying, I work out and I feel it popping over my elbow, but it doesn't hurt. Should I get surgery? And if you don't have any pain, you're not anywhere close to needing surgery. But you should be conscious that it's popping back and forth over the bone, and if that's causing you tingling, right, then something is, irritating your nerve, and it's probably only a matter of time before you start having pain on the inside of your elbow. That's how it happened for me, but it doesn't always happen that way. I had numbness first on this right hand, and then I got the pain here. With my left, I just kind of got the pain and numbness right off the bat. So everyone's different. Every case is different. But, try different things like I've talked about before. Try sleeping with the brace on or towel wrapped around your elbow so you keep your arms straight when you sleep at night. Don't talk on the phone like this. Don't, if you're working out or anything, don't be doing overhead stuff like this. Don't sleep like this is probably one of the worst things you can do, or be sleeping like this. Keep it straight when you sleep, and just in general throughout the day, try to keep your arms straighter. Don't be leaning on your elbows. Don't bend them. Those types of things I think will buy you time if you have this. If you detect it early and you say, you know what, something's popping over my elbow, and I get kind of tingling here sometimes. There's a variety of activities in your daily life that you will certainly become aware of that irritate it, because whenever this arm is going to be in a flexed position for any amount of time and you're doing anything, it's going to start irritating that. So just try conservative things. Keep an eye on it. If you start getting pain there, at least you've already found a doctor that, you've discussed this with, and you can go back to and say, hey, this is starting to hurt. Then you can get it addressed before it gets bad. When I say you're not, if you're not having pain or whatever, you don't need surgery. I guess that's not necessarily true too, because you could have really bad numbness and no pain at your elbow. So if you have any symptom that is extreme, that's probably a sign that something needs to be done soon. But if it's only popping over and you kind of feel tingling in your fingers only when that happens, and that's maybe for the half hour that you're working out at the gym, then it's probably not too bad, and you might be able to do some conservative things to treat it. But if your numbness is persistent, if your pain is persistent, if it starts getting extreme on either side, that's when it's time to have the discussion about surgery. And another thing to keep in mind is find a good hand surgeon that deals with cubital tunnel frequently. If you see an orthopedic surgeon, which all these guys are, but sometimes people are, I didn't know this. I went to see somebody who does orthopedic surgeries on the elbow because that's where it hurts. But a lot of these guys do stuff sports related. Let's say somebody's got a really bad case of tennis elbow or golfer's elbow, or they dislocated it or they broke their elbow. They kind of do that stuff more. um, they know about the ulnar nerve, and they probably do stuff with the ulnar nerve when they do Tommy John surgery or this and that, but that's not like their main forte. They're not doing ulnar nerve transpositions or ulnar nerve releases like day in and day out. Find somebody that does that, because they're going to understand that, while doctors will want to get nerve tests to kind of get a gauge as to how bad yours are, that's not always necessarily a perfect indication of whether or not you need surgery or whether it's time to address it or not. Sometimes you can have all these symptoms going on and bad pain and numbness, and your nerve test comes back and it's not that bad. That does not mean that you don't have a problem. You clearly do. So again, how to know when you need surgery. Find a doctor that deals with this frequently. Identify exactly what's going on with your arm, and then keep an eye on it. If it's not, that bad, try conservative treatment. If that doesn't work after a couple months, then start to think about surgery. I wouldn't let it go. If you have persistent symptoms that are interfering with your daily life, I wouldn't let that go more than like 6 months to a year. Because if you do, then you're going to just decrease your chances that you're going to get a full recovery once you do get the surgery. So, don't jump into surgery, but don't put it off thinking that you're going to fix yourself after a year of dealing with this, because it's not going to happen. I can tell you it will not go away. And there's a lot of other people on here that will tell you the same thing. It's not going away. So anyway, I hope that helps. I'll start trying to do these videos a little bit more frequently. Really, they're going to be as frequent as you guys give me questions. So I'll be a little bit more diligent about answer your questions. I feel like this is a little bit easier because when I write them out, I start finding that I'm writing the same thing out to everybody on multiple pages, and some people don't see the answer to the question. So this way, your questions can help to other people that have the same questions. So I hope that helps you guys that have that question. And as always, ask me more and I'll respond, and I'll share my experiences with it and my opinion. And as always, aloha.